host secret parties, stuff your bar or restaurant to capacity despite the warnings, ignore common sense in your worship practices. It's not a political statement. You're hurting your neighbor who is desperate to keep their business open, or your friend who has an immunocompromised child who has been inside for months, or your parents who don't have the same defenses against this virus that you may. This isn't about politics or campaigns. It's about people that we love and care about in our own communities. Here's what I know for. We've seen some success, however relative, while other states are surges. Because the people of this state show up for each other, show up for science, show up for our doctors and nurses on the front lines, and show up for your community time and time again. That should give us all great pride in Illinois. We need to keep showing up for one another now more than ever. So thank you, and I'd like to hand it over to our IDPH director, Dr. Ngozi Ezike. Doctor.
Thank you, Governor Pritzker, and good afternoon. First, let me just start off by saying that there is no more ardent supporter of the success that we have enjoyed in Illinois with respect to this coronavirus than our leader-in-chief, Governor Pritzker, so thank you for your tireless efforts. And second, a point of clarifications regarding the 3 Ws. There's not mine, it's ours. I saw it out there, and I think there's importance in widespread messaging that we all use the same terms. And so I saw that and said, yes, that's a great thing, and I want not just our state, I want the country to hold on to the washing our hands and wearing the face coverings and watching our distance. So if I were to make my own, I think I could inartfully come up with something. C's, the 3 C's, cover your face, clean your hands, and the last one's a little bit harder, count your 6 feet of distance. But the fact is we are still in this pandemic. No one asked for a global pandemic to rock our world, to steal our loved ones, to totally upend what's normal. No one asked for our daily routines to be disrupted. Nobody asked for our summer, what we used to know as summer, to essentially be canceled or significantly changed. But the invisible enemy persists without a vaccine and without an effective cure. So yes, we stayed home initially and we made it very hard for the virus to infect. And that was so key, and that's why we're sitting on the success that we have. That's why we have the lowest positivity rates for any states in our region. Less people infected meant less people hospitalized. We went from having 800 individuals lose their lives in 1 week to having under 200. And of course, under 200, 150 is still too much. But please appreciate that significant decline. Our positivity rates have come down. Our hospitals for COVID are lower than what they were months ago. And no matter where you go online, again, other people are sharing different facts. Illinois is always on that small list of states that's trying to get it right and maintain that. So that's great. But here's the kicker. As we opened up and graduated into phase 4, that more people were out and about. And what does that mean? That means there is the greater chance of getting infected. Remember, we still don't have a vaccine or a cure. But the deal was that as we go out and try to get back to some level of normalcy, that we would have the mitigation strategies in place. And those were the 3 Ws, the face covering, washing our hands, watching our distance. So I thank all those who have been adherent to those 3 Ws, but we need more uptake of this, and we need more participation in this key measure that is supposed to help us fiercely guard the successes that we have seen in Illinois. The governor stated there are multiple, dozens and dozens of reports just this week of outbreaks from a myriad of different activities, from house parties to sports, to churches, to travel, to hotspots outside of the city. But I also want to highlight the who of many of these new cases that we're seeing. Please be aware that young people, again, breaking the age ranges in deciles, ages 10 to 19 and ages 20 to 29, They are having higher case rates now than ever before in this pandemic. We are following this very closely, but young people and parents of young people, please be aware. This virus is now being spread by youth, by younger people. So young people, we need you to make responsible decisions to help us continue to keep our successes and decrease and minimize spread. And of course, parents, as additional support and leaders for these young adults, I pray that you will assist and guide these teenagers and young adults to make the right decisions, as everyone's decisions affects all of us. So numbers for the day. Since yesterday, 1,187 new confirmed cases were reported to IDPH, which brings our state total to 156,693. Unfortunately, 8 deaths were reported to IDPH, which totals 7,226 deaths lost to COVID at the beginning of this pandemic. Again, as of last night, 1,454 individuals were reported to be hospitalized with COVID. Of those, 324 patients were in the ICU and 130 patients on ventilators. Our goal of increased access to testing is continuing. In the past 24 hours, 38,161 tests were resulted. And earlier this week, we crossed the 2 million test mark. We are reporting out more and more test results because more of you are getting tested. And maybe more of you are getting tested because you have identified exposure risks. Important reminders as we are out and trying to live our lives. We cannot control this situation without mask distancing. We cannot. Number 2, if you learn that a friend or a relation or a contact of yours tested positive, you have to undergo a 14-day timeout. You need to wait at least 6 to 7 days after your exposure to get tested, because that's a better chance of showing a positive test result. If you find out a day after you got contacted by your friend that the day before they were positive and you were with them just that day before, it's too soon to get a test. So please, a 6 or 7 day window after your exposure is the ideal time to get tested. But even if that test is negative, a negative test does not buy you out of the 14-day timeout. I know that's hard to take. You're feeling fine. You got an initial test. It says you're negative, but test is not enough to take you out of the 14-day timeout. We have many individuals that have not been positive on day 6 or 7. Up to 30% of people might still be positive or develop symptoms on day 8, 9, 10, up to day 14. So in the interest of not spreading it to other people, we have to do that 14-day quarantine. Also, if you have a positive test and you don't have symptoms, you still have to isolate for 10 days. Not having symptoms does not mean that you're not infectious and does not mean that the test was wrong. And to help the general process, please, we have to be vigilant. Keep track of where you have been and who you have been around. In the event that you do test positive, that you can help identify as the contact tracers reach out to you, as you even take your own responsibility to reach out to those who may have been exposed. Make sure you notify your employer, your social networks, your family networks, your religious groups, your sports groups. Please be a responsible citizen and share to people who may have been exposed in case you get to them before the contact tracers do. Cases are increasing across the country, and even in some areas in Illinois. With our local health departments, we are aggressively identifying outbreaks in Illinois to kill them before they spiral out of control. I continue to salute my team at IDPH as well as all of our local health departments for their work since the beginning, but it's not or. So outbreaks are identified in several different ways. Local health departments can identify them through case investigations, and that's why it's so critical that the public cooperates with our contact tracers. When they call, we need as much information as you can provide. We're still up the number of contact tracers, so we're going to have even more people making these calls. We need your help in giving them complete information. Facilities may contact the health department to report that a group of individuals have tested positive or have symptoms that are concerning. And then IDPH also looks through our many data sets to identify different clusters. We want to identify as much as possible. We need to know where it happened, who was involved, how many people, where were the likely exposures. It can be, as mentioned, in sports settings, bars, restaurants, factories. We've seen daycares, any place is possible. Local health departments in consultation with IDPH will recommend control and outbreak response measures, which include quarantining of the close contacts. That's the 14 days from the exposure to wait and see if symptoms will occur. Testing plans are shared and improvements are needed to prevent transmission with infection control procedures in place. A few weeks ago, we announced the arrival of Phase 4, which was a testament to how well we as a state responded to this pandemic. We did it together, and we are still needing to work together to get through this. The 3 W's will lower the spread of the virus. That's incontrovertible. The important actions and advices today will directly affect what school looks like in the fall. We all have a hand to play in what our future looks like. Please bear any inconvenience that you think is associated with wearing a face covering. Bear that inconvenience to prevent much larger inconveniences down the road. I implore your support. I implore you to follow the 3 W's. I implore you to take care of your fellow resident here in Illinois. Thank you.
8%, I believe is what it was, right? Over 3 days.
Yes, if we spike to it, that's what that's meant to be. It's a fail-safe.
What is immediate action? What are the consequences?
Well, again, there's a menu of things, and I talked about some of them in my remarks. For example, and I mentioned yesterday, bars as an example of something that would certainly be, it's a thing we look at. We've seen studies of the spread transmission that can take place if bars are overcrowded. And often, even though there's been a capacity limit of 25% put on bars, they are not following the rules in many cases, and there's transmission. That's one example. Another example is youth sports. We've seen this summer just some examples I talked about. And so those are among the menu of items you heard me talk about. But let's not focus on the 8% fail-safe number. This could happen much before that. In other words, the menu of items that are mitigants are about the numbers moving the wrong direction in a sustained period of time. That doesn't mean it got all the way to 8%. It could be that a region is moving quickly upward but doesn't reach 8%, but over a sustained period of 7 days of 10, the 7-day average positivity is moving up. That is a trigger, along with the availability of hospital beds or the increase in hospitalizations. So those are, I know it's complex, but we wanted to lay out for you and be very transparent about what the triggers are, what we're looking at. I've said to you all every day, I wake up and look at these numbers on a daily basis. I look at the rolling averages of these numbers, and so does Dr. Ezike, and we're constantly evaluating and making decisions about what is it that we may need to do. Long before we ever get to those points, as you heard, I call local officials. Dr. Ezike speaks to the local health department to say, there is a problem in your county. What are we doing? How can we be of help to you? What are you doing? Local governments have the ability more immediately to do things than state government does, and so we encourage that. But where state government needs to step in, we do and we will.
To what degree do you think the reversal in numbers you're starting to see is, are people just becoming complacent, or is it simply Illinois being an island in the middle of these spiking numbers in neighboring states?
It's an excellent question. You are right on. We ask that question ourselves too, because when you look at areas like St. Clair County and Madison County, right across the river of St. Louis, Missouri has I forget the exact number from Missouri, but I think it's around 1% positivity rate. Ours is 3%. So if you live in that area and you're traveling across the bridge to Missouri, you're essentially doubling the possibility that you will, could contract, or at least the number of people that you end up in front of. It's very important for people who live in those areas to be aware of following mitigations that we've suggested in Illinois. In other words, making sure you maintain your distance, wear your face covering, even if it isn't required in the state that you're into. That you want to protect yourself, certainly. You hope that people there will be protecting you. So we worry about the border areas and people who come over the border. Some people live in Illinois and work in a state that's bordering Illinois, and they every day go back and forth. And that doesn't mean that they're in any greater danger as long as they're maintaining distance, wearing a face covering, washing their hands, following the mitigations. So that's one thing. To what degree is this about complacency and people just deciding that, I'm done with this? Look, we worry about that, of course, and I think you see that there are young people. I don't know whether they're following mitigations earlier, but you often see young people going to bars or just, gathering in large groups, having parties with one another, not thinking that either they're vulnerable or that they could be carrying it to someone who is vulnerable. So we worry greatly about that. We have a lot of social media. That's why we've done outreach to organizations all across the state to ensure that people are paying attention. And then I can't help to mention that there are people who view this as political, that wearing a mask is, and keeping your neighbors safe is political. It's not political. This is just about caring about your community and about people you love.
To follow up on the young people, and this might be better for Dr. ZK. Sure. The statistics the city released today showed that by far the largest group of new cases were in the 18-29-year-old, 30%. Can you tell us on a statewide basis, are you seeing similar things, and how does that age group compare with previous data?
Right. So I will say that we've made tremendous progress with our long-term care residents, which are obviously a much older population, and so that used to be a very significant driver. But in the recent weeks, we have seen that the 20 to 29, and again, we have so much data, and when you break it out, it might be the case for, I think, non-Hispanic whites, 20 to 29, that's the largest group. Then you also had that in blacks, 20 to 29. But you've never seen this high rate for the 10 to 19. That is new in terms of the numbers climbing over time. They're now at the highest rate that they've ever had from the beginning of this pandemic. So. I can't remember all these numbers off the top of my head, I'm sorry, but I can make sure that they get that to you. But as we follow over time and as we follow the total people who are being infected, who are now being infected, we are just seeing that there's a new shift in where the burden is lying, and that's why we're trying to elevate that. And we have a youth forum that we're working to try to elicit input from young people, because we need to understand what they need to have to make the best decisions. Is it that they don't understand that they can infect and go on to infect others? They really think that they can't get sick, because we do have many examples of young people without comorbid conditions. Do they understand that if they are infected and have a history of smoking or vaping, that could portend a much more serious? So we want to make sure that the young people actually have the information. Maybe it got mixed when we talked about elderly people in the nursing homes, and they thought maybe they were somehow immune. So we want to correct the narrative if it was misunderstood and make sure we get them the right information.
I don't mean to hog here, but just 10 to 19, that would suggest, even though a lot of focus has been on bars, right. That would suggest an age that, of course, can't be in bars. So where is the source of this?
So that, I have teenagers, right? They've been on lockdown, but they are complaining that their friends are out and about. And so kids are congregating.
Or social action?
Yeah, social actions, social gatherings, home get-togethers, trips
Sports.
that are not sports, that are not involving, masking and distancing.
So how does that pretend for schools?
Well, we know that if schools are to happen, there has to be masking and distancing. But to get there, we have to not have widespread community transmission at rates that are not sustainable to even safely do school. So that's why our actions today, right now, will determine what school even looks like. So we need to get the gains that we have achieved. We can't rest on them, but we need to aggressively and fiercely protect it. And that will involve universal masking and distancing. Thank
Can
you.
we talk about the new health regions?
Yeah,
Because
sure.
I think that's important today.
Sure.
Probably folks are going to be in the Collier counties say, great, we're no longer part of Chicago, or we're no longer part of Cook County. But I'm just wondering down the road, if you do have to go backwards, are you also then saying folks from Chicago might travel to these other counties because you can't dine out in the city? Should that happen, hypothetically, are you also creating perhaps some confusion statewide by adding more health regions?
Here's what people have been traveling between these counties, and we talked about Kendall and Grundy. There live in Kendall and Grundy who travel to Collier counties, and just like we were talking about people who travel the border to go to Iowa or to Missouri or to Indiana. So there's a degree of personal responsibility people are just going to have to adopt. We're setting these regions because we need to be able to monitor properly where there are outbreaks, where there are communities that are in danger, and to make sure that we've got hospital beds and healthcare availability for an outbreak that might take place. So. Look, we're not going to stop people from traveling between one county and another county, nor do I like the idea of stopping people from crossing the border to another state. I think people need to be aware, and that's one of the reasons that I have press conferences and have been very transparent about this. I want people to be aware that Illinois has around a 3% average positivity rate. Every state around us has double that or more. One of those states has a 9% positivity rate. So just know that when you go into an area that you need to take extra precautions, recognizing that we have real gains here that haven't been realized in other places.
Governor, we haven't been able to talk to you since the new IDES phone system rolled out. We've talked to a number of people that have been tracking them, that on the first couple of days they were told they would get it back in 2 to 3 minutes. It's now been a week or 8 days. Can you talk a little bit about the state's accountability as it pertains to rolling out a system that's supposed to save people time, and in reality, they're not getting any call?
Well, let me start with this has been an enormous challenge. I think you're aware of that. And I have made myself available for questions, by the way. You have been able to, yesterday, in fact, I was in front of the press, and I've been in front of the press quite a lot. But so I'm happy to answer your questions. This is an enormous challenge. IDES, was overwhelmed. There's just no doubt about it. I've talked about some of the reasons for that, but that's less important than, how can we overcome the challenges. We have more than 500 additional people answering phones. That's in addition to the people who were already working at IDES that were in charge of answering phones to begin with. And we've moved people from back of the house to front of the house to answer phones. Phones are absolutely, in this ridiculously enormous wave of filings, and don't forget, people have to refile every week. You have to reach every week. And to the extent that people are using the phone to do that, or to, in any way to avoid being online, I would say if you can go online, if you can work online to get your filing in, to re-verify, for example, or just to file originally, that is absolutely the best way to do it. Not 100% of people are successful at doing that, but quite a lot, because we see the numbers, and literally hundreds of thousands of people, much easier for them to have done that online. As to the calls, and again, there's no doubt about this is where the big challenge has been. I want to solve this as much as anybody. The challenge has been, even with additional people answering phones, that in order for them to deal with your specific case, they have to meet a federal requirement that is about 10 months of training. We haven't even been in this pandemic for, I don't know, more than 5 months. And having said that, we've tried to take any call that doesn't require that federal level of expertise and move that into a different category and try to get people there. You're asking